Hi, I'm Kathy Hines, IBCLC. I'm going to show you in this quick video how to hand express. This video is meant for, especially for colostrum collection, because that's usually very thick and in small amounts. The typical feeding for a baby on day 1 of life is 5 milliliters. Very small amount. You see those big bottles of formula, they're way too much. While breast milk is not one-to-one with formula, breast milk actually, you need less of it to equal the nutritional value of the same amount of formula, or the same calories of formula. When we're hand expressing the colostrum, it often is in very small amounts. Babies are more effective at it, so if you can latch them, that's always the best thing. But if you want to start doing prenatal colostrum collection, or in the 3rd trimester, or if you want to, if your baby's just arrived and you need to use some hand expression techniques, these will work really well. All right, so this is my practice boob. So first thing I'm going to have you do, see if I can get far enough away from it, is I want you to feel around your breast. And the reason for that is you're looking for firm areas. They're more firm than the rest of your breast. The reason is some people have, when breasts are formed, they're not necessarily going to be completely symmetrical throughout. They're not going to, where a lot of people do have the glandular tissue right just past the areola. For some people, it's all the way at the chest wall, and the ducts just bring it forward. They all function fine, but it may adjust how the way you are hand expressing. So the first thing you do is kind of do some massage a little bit. That also loosens the milk up, but you can feel where the firmer spots are when it's colostrum. And then you can see where they are. So say if they're close to the areola, you see how my fingers are kind of on the edge of the areola. I am going to compress the breast. You see it going backward, and my fingers are going slightly apart. And then you come forward. Now, do not do it so that it hurts, please. It's really easy to hurt yourself because you're trying to get the milk out, but hurting your breast is going to have some inflammation, and then it's going to make it harder to get the milk out in the first place, and after that. So that's one of the techniques, is to do it that way, where you're pressing. I'm exaggerating, you won't do this much, but backward and then forward and together. And you'll just make that motion. Now, if you are if there's a slightly different technique, you can also do where you're at the same spot in the front, but usually bring it up a little bit higher, and then you can bring your fingers together, but while you're pressing back. So it'll end up like that. Now, if you are a mother that is, or if you're breastfeeding and your breasts seem to have a lot of the fluid in the back, or you want to use this particular method, there is a 2-handed version. Like I said, this works really well if you have your glandular tissue, which is those firm spots that are holding the milk. They may be towards the chest wall, or you just feel better doing it this way. You can use your hands up and down on the breast, and then say the glandular tissue is here. You're going to be kind of bringing the milk upward. You can also slide your fingers across, and you can do that with both hands. Obviously, I can't because I'll drop it, but your breast will hopefully be attached to your body. And you can press it, and then you can bring it up as far as you need to. Again, if it hurts, you're doing it too hard. To start, it helps a lot to start your letdown first. So that's where part of that massage is going to help that. You may also want to kind of lean over and move the breast around a little bit. Smelling your baby's head may start a letdown. And letdown is just simply where the milk is back in the cells, and you trigger it. Sometimes it takes up to a minute to happen, but you triggers it, and then it starts to squeeze the glandular tissue and push the milk out of the breast. So that's to get that started. It happens several times throughout a feeding. Sometimes people feel it, sometimes people don't. Sometimes they feel one of the letdowns and they're not going to feel the rest of them. And that'll be for another video anyway. But that, you get the letdown started by doing those techniques. That saves you time because you don't want to be hand expressing and then forever, and then before your letdown, your letdown hasn't started, and it's kind of worn your hands out before you can actually get any milk. Now it will be drops. That's totally normal. Colostrum is very thick, very high in calorie, much higher in calorie than formula or even the mature breast milk that's going to be becoming more prevalent the next few days. So it's very thick, very small amounts, but it has high immunoglobulins and important things that your baby needs to be able to get the bilirubin out, to get the meconium poop out, that's that black poop, and to kind of get them, kind of coat their intestinal wall, and also to make sure that they get a lot of the antibodies from you to kind of have them ready face the world. They get some in pregnancy, but they also get a lot of it from colostrum. So I hope this helps, and if you have any questions, please feel to reach out. Thanks. Bye.